The fixed digital X-ray machine. This is the cornerstone of modern hospital radiology departments, featuring a heavy overhead crane or a floor-mounted stand that allows the X-ray tube to slide smoothly across the room. Patients either lie on a motorized table or stand against a vertical wallboard, while a massive digital detector captures high-resolution images of bones, joints, and organs within seconds. Unlike older film systems, the digital sensors transfer the image instantly to a radiographer's computer monitor, drastically reducing the time a patient spends waiting in the exam room. These stationary units are engineered for maximum power and stability, making them the default choice for routine chest films, orthopedic assessments, and emergency trauma imaging where precision is critical. The mobile portable X-ray machine. This device looks like a compact motorized cart on wheels and is designed specifically to bring imaging capabilities directly to a patient's bedside. It contains its own internal battery power and a compact X-ray tube attached to an adjustable articulated arm that can maneuver into tight spaces. Radiologic technologists drive these machines through hospital corridors to the intensive care unit, neonatal wards, or operating rooms where patients are far too critical or unstable to be safely transported down to the radiology department. Modern versions utilize wireless digital plates that slide underneath the patient, allowing doctors to view life-saving images of lungs or line placements on the machine's built-in screen immediately after exposure. The C-arm fluoroscopy system. Named for its distinct semicircular arm shaped like the letter C, this specialized machine provides real-time, moving X-ray images rather than a single still photograph. The X-ray source sits on one end of the curved arm, while an image intensifier or digital flat panel detector sits directly opposite, allowing the entire structure to rotate completely around a patient lying on a surgical table. Surgeons rely heavily on C-arms during orthopedic surgeries to guide the placement of pins and plates, as well as during cardiac catheterizations to visualize blood flowing through arteries in real time. Because it shoots a continuous or pulse stream of low-dose radiation, the machine allows medical teams to watch live video of internal anatomical structures as they operate. The computed tomography scanner, often called a CT scanner, this large donut-shaped machine represents a massive leap forward from traditional flat X-rays by capturing cross-sectional slices of the human body. Inside the circular gantry, an X-ray tube and an array of digital detectors rotate at incredibly high speeds around the patient as the motorized exam table slides slowly through the center opening. Instead of overlapping structures like a standard film, the computer processes thousands of individual data points to reconstruct highly detailed three-dimensional images of soft tissues, blood vessels, and complex bone fractures. It evolved from primitive, slow-scanning prototypes in the 1970s into the ultra-fast systems used today to instantly detect internal bleeding, strokes, and tumors in emergency settings. The mammography machine. This highly specialized X-ray unit is engineered exclusively for imaging breast tissue to detect early signs of tumors and calcifications that are too small to be felt during a physical exam. The machine utilizes a dedicated compression paddle to flatten the breast tissue firmly between two plates, which serves to optimize image sharpness, minimize the necessary radiation dose, and hold the tissue completely still. While older machines produced flat two-dimensional films, modern facilities predominantly use three-dimensional digital breast tomosynthesis. This advanced variation moves the X-ray arm in a subtle arc over the breast, taking multiple low-dose images from various angles to create a layered view that makes it much easier for radiologists to see through dense tissue. The Dental Panoramic X-ray machine. This specialized apparatus captures a wide, continuous view of the entire mouth, including all upper and lower teeth, the jaw bones, and the surrounding sinuses, within a single panoramic image. During the scan, the patient stands or sits completely still in the center of the unit, while an integrated X-ray tube and digital sensor rotate in a synchronized semicircle around the back and sides of the head. Dentists utilize these machines to evaluate wisdom, teeth alignment, assess jaw joint disorders, and plan comprehensive treatments like dental implants or orthodontic braces without needing to place multiple small film packets inside the patient's mouth. The resulting image stretches out the curved anatomy of the jaw into a flat, easy-to-read layout that highlights structures hidden beneath the gum line. The bone densitometer. Frequently referred to as a DEXA or DXA scanner, this specialized machine uses dual-energy X-ray absorptiometry to precisely measure the mineral density of bones, primarily targeting the hip and lower spine. The patient lies flat on an open padded table, while a scanning arm passes slowly over the body, emitting two distinct, low-dose X-ray beams with different energy levels that differentiate between soft tissue and bone. By calculating how much radiation is absorbed by the skeleton, a computer determines bone strength and produces a specific score that helps doctors diagnose osteoporosis and predict a patient's risk for future fractures. The radiation exposure from a DEXA scan is remarkably low, equivalent to a fraction of the dose received during a standard chest film, making it a safe and effective screening tool.